All right, let me start. Here we are going through this, what I would call an unimaginable and completely unexpected pandemic. Never thought that this would happen in my lifetime, including having all the businesses like ours shut down, which has necessitated us to change what we do. And that's why we're doing what we're doing today. I'm so glad that everyone is here, able to take advantage of this time at home and this time for our very first webinar. So speaking of it being our first webinar, as you can see, sometimes there are going to be little technical difficulties. So bear with us with that. We've run through this a number of times and worked pretty hard on this. So bear with us if we do anything that needs a few moments to correct technically. Before we begin the full presentation, I also wanted to go over some housekeeping items with you. We are going to put up some polling questions. They're just things that when you have a moment that you can answer these questions. I think, Brianna, are there 4 of them?
3.
Yeah, 3. So they're just fun things. We thought we'd take a poll and you just go through them, 3 questions, and at the end, we'll kind of give you all the answers to see what everybody's issues are or what they'd like to have done. So that's some polling questions we'd like all of you to do. Second, I do believe that you are all on mute, but if we start hearing noise or someone is not on mute anymore, we're going to ask you to find where it looks like a little microphone to make sure that it's off, so that you only hear our voices and we don't hear any background noise. We'd also like to really encourage participation. We're going to give this presentation on some of our secrets, but we'd like you to participate also on whatever type of device, whether you're on a phone, an iPad like I am, or a computer. There's usually a spot that says Q&A in a little box. Mine happens to be at the top. That is something that when you click on it, it pulls, let me actually do it. It pulls up a space where you can write in a question. So please, we encourage participation. Go ahead, ask us some questions. We also wanted to let you know that this is being recorded and we might share it afterwards, parts of it or all of it. In fact, you can probably go and find it a little bit later today on our YouTube channel, which is a nice way to follow some other really nice videos that we have been posting that you could watch while you're at home. There will also be a post-event survey. So grab a piece of paper, maybe a pen to take some notes. Those of you that are on a phone or a iPad like I am can always screenshot something too if you want to remember. So let's get this started, unless you 2 can think of anything else.
Yeah, let's go.
All right, let's go to the first slide, Brianna.
Okay.
So what have we been all doing during this quarantine? I know I've been reading. I've been watching some Netflix. I've been walking my dogs like crazy, to the point that I don't think they even want to walk anymore. But I've also been looking in the mirror a heck of a lot more. I don't know if I'm stressed because about work and money and am I going to get sick? But I don't think I look my best. I see bags under my eyes. So I know a lot of people have also been doing the same thing. We're at home more, we're passing a mirror more, we're not at work. So we are finding people telling us that they're seeing things different. They're seeing dry skin, dull skin, maybe from being nervous, they're breaking out, or maybe they're just not looking your best. So we came up with some things that while we're all still quarantined, that you can do now, right now, while we're not all back to work yet, to take some time at home to invest in yourself. So we have some secrets. We have some secrets of things that you can do that are things that right now at home, we love to have you in our practice to have procedures done, have hydrofacials and things like that, but we can't do that right now. So some of our secrets are going to be home facials that you can do. And then the third one is a peel, an actual peel that is meant to be done at home, because we do peels in the office, but the one we're going to talk about is meant to be done at home. We're also going to talk about some home care products that will maintain your results over time, and also a long-term plan for what you can do. So today's purpose, we have a couple purposes. Since we have the downtime, how can you take advantage to live your life counterclockwise? What can you do when you're done watching movies and Netflix? What else can you do for yourself? We want to arm you with tools that allow you to do things at home that are treatment related, but as well as skincare. And we also want to remind you that you're not going to be alone. We are here and we will be able to coach you through on any one of the three that we're going to be talking about. In fact, if and when you purchase one, you will be assigned, either Geri or myself, to go through the whole process with you and help you through it. So here, let me take a moment here to stop and pause and introduce us. My name is Nadine Custer. I am a physician assistant at Esthetic Plastic Surgery. I have been there for, I want to say this is my 18th, the start of my 18th year, and I've been a PA for 30-something years. I absolutely love what I do. I go to work every day saying that I do love my job. I also want you to meet Geri and Brianna.
Hey y'all, I'm Geri. If you don't know me already, medical esthetician at Greensburg Spa Esthetic. Here I go, I lose it already. I'm just happy to be here. I'm so glad that we're able to put this together and do this. Like Nadine said, this is our first time. We're all pretty nervous about it, I'd say, but welcome, and we can't wait to get into everything that we've got to share with you today.
And I'm Brianna Kane. For those of you who don't know me, I'm the practice manager, and I get to work with these two lovely ladies as well as our other team members. And we are really excited for today. We have a lot of great secrets and great things to help us stay connected to you while we can't actually see you. So with that,
the first thing I want to talk about is a skincare line that we have at Esthetic. It is called the ZO skincare line or skin health line. It has been around for quite a long time. And I did want to tell you a little bit about the history of it. Dr. Zen Obagi, which is where the two initials ZO come from, is a practicing dermatologist out in California, and he's still practicing. His original Obagi skincare line actually started in 1988. So that's over 32 years ago. In that time, he continues to do research and testing and continues to look at skin from, you can't believe the scientific level that he looks at skin for treatments and different procedures with his skincare products. We carry the ZO Skin Health line, and I feel that it really is the premier or elite level of skincare. It is prescription based, and it can only be sold at physicians' offices. We only carry one line of products, and it's this for prescription skincare. We feel that strongly about it, that it can do everything that we want it to do, whether it's anti-aging, acne patients, rosacea, younger patients with acne. It can cover any one of those. I really do feel strongly that it can do that. The other thing is most, if not all, these products, you know, as they're being sold through a physician's office, they are being dispensed by licensed professionals. That means that we have the background, we have the training, knowing these products inside and out, selecting which ones are right for you. And I think that's very important, because you can order other products elsewhere on TV, on QVC, at the mall, and various other places, but who is selling that and how are they licensed to be selling that and choosing your products? So the ZO Skin Health line is our product line here, and we're thrilled to have it. So before I actually get into the first two facials, I wanted to talk to you about getting skin ready. And if there's nothing you take away with at this meeting, the one thing I want you to take away is GSR. What is GSR when we say it? GSR is getting skin ready. It is actually the fundamental part of the skincare line. It encompasses cleansing, exfoliating, and toning. They meaning Obagi or Zio Skin Health, actually did a study where they had patients use only the cleanser, exfoliation, and tone for a period of time to see the improvement. And every single one of those people that were in that study showed improvement. And they were not even using any of the higher end products for anti-aging. So we feel very strongly that although I love all the retin-A's and retinol products, this is a very important part of your skincare, including the 3 peels we're going to talk about. So the very first one I'd like to talk about is called the Complexion Restoration At-Home Facial. So this is just a few steps that we'll see in a moment, but the ideal candidate for this one is someone that does have issues with acne, whether it's a teenager like my son. And I must say, I've done this facial, at-home facial on my son a number of times. Or if you're having hormonal, if you're a female that has hormonal breakouts, teenagers with acne, just in general, even if you're not breaking out, excessive oiliness and large pores. It is a gentle facial that you can do at home, but it's more aggressive than just using one product for something. It will exfoliate, treat and prevent acne, or at least help control it. I am a firm believer that sometimes acne just needs to be controlled. Reduces surface oil, and it helps keep your pores clear and the skin smooth, and it calms the skin. So the next slide shows the steps of the peel. It really is relatively easy. Step 1 is you follow your regular GSR, you're getting skin ready, which is you cleanse, you tone, and exfoliate. That is something you should or could be doing all along. The second step is something called the sulfur mask. The sulfur mask is, oops, let me pull everybody back up so I can see myself. The sulfur mask is a very nice product that is rather thick. I do, if I can, let me try to show you. It's a thick product, and when you put it on, you do put it on pretty darn thick. And it comes out very blue looking, like that. And that would be all over the face. Our instructions here say that the sulfur mask is left on for 10 to 15 minutes. I think some people say that they feel a tiny bit of stinging, and really it's for 30 seconds. So if you've just washed your face, pores are open, and you put this on, you are going to feel a tiny bit of stinging, but it literally is for 30 seconds or less. You will keep it on for 10 or 15 minutes. You will then go ahead and rinse that off, and then use the complexion renewal pads. Those are pre-moistened cotton pads in that container, the third one down. So you're going to want to cleanse your skin with that, and then apply the enzymatic peel, which you will not take off. You're going to leave that on overnight. So the enzymatic peel is this one. Let me see if I can show you what that one looks like. So the enzymatic peel is a whole different consistency. It actually, when you put it on, I think it's, to some degree, it stays kind of thick like that. If you can see how shiny it is, it stays like that. Like I have tried to rub it in and rub it in. It will, within a few minutes of you leaving it on, completely rub in. But that's generally how I leave it when I put it on, as that step.
Nadine, just to jump in, the sulfur mask is so great too, because you can spot treat with it. I know I spot treat a lot with that. If I get any kind of a breakout, I put it on and leave it on overnight, and it's amazing how much reduced redness and
oh my gosh, Absolutely.
Yeah.
Almost every night my son goes to bed. He goes to bed with blue spots all over his face. Yes, and it does. It might not make it go 100% away by morning, which is what we wish it would. Definitely makes it less inflamed.
Yeah.
So that's this peel. So basically you are just doing the GSR, getting your skin ready, the sulfur mask for 10 to 15 minutes, washing it off, using the complexion renewal pads, and putting on the enzymatic peel that you leave on all night. And I just did this one Tuesday of this week, this exact peel. And I woke up in the morning and my skin felt so smooth first thing in the morning. So that's the first peel we want to talk about.
Just to ask
And
a
that
question, Nadine,
go ahead.
how often can you do that?
This one could be done once a week. It is
Okay.
something that you could continue to do once a week for your skin.
Perfect.
The sulfur mask alone, if it's an acne patient, the sulfur mask alone as well could be used by itself once a week or twice a week. In fact, I've used it for my son.
Awesome. Now let's jump to the next facial.
Okay, what's our next facial? Oh, this one is called the Skin Brightening at-Home Facial. So this one does a little more. It does a little more and something different. It actually is more of how can we accelerate exfoliating someone's skin and give it an antioxidant boost. This is good for someone who's just saying, my skin looks so dull, or I don't like my skin tone, it looks uneven. It can still help with oily skin or that T-zone acne and oil. You will with this one find somewhat brighter skin, exfoliation of dead skin cells, better product penetration throughout the rest of the week. It'll help some degree even skin tone. Very often if we have a significant issue with skin tone, then we have to go into procedures, but this will help with that as well, and it can help minimize the pigmentation. This as well has a few steps to it, and we'll go to the next slide. So we're still talking about the skin brightening protocol. So that is, like I said, the exfoliation one, the one that will brighten your skin, give you smoother complexion. So step one of this facial as well is going to be getting skin ready, the GSR step. You're going to wash, cleanse, tone. Cleanse, tone, exfoliate, sorry. Step two, that same enzymatic peel that we used for the first one, you are going to put on. You are, and all over the full face. I generally extend it a little bit down my neck, but there's no reason you can't extend it the whole way. So getting skin ready for the skin brightening one, enzymatic peel, you don't rinse it. Then you're going to apply 2 to 3 pumps of a new product that we haven't talked about. This little guy here is called the Exfoliation Accelerator. So this one is going to be 2 to 3 pumps. It as well has a little bit different consistency. It's a white product. So this is going to go on top of the enzymatic peel. So that one you're just going to put on just like that over top of the enzymatic peel. So that is the peel itself. You could also add the vitamin C serum, which is a 10% activated vitamin C, could also be used in this peel. I would use it at the end. Oh, I can already feel it's prickling a little. I can feel just a little bit of prickling right there. So that's completely normal. Yeah, because I have both of those on there for me. Let me get that off. So this peel is a little bit more, it's going to do more for anti-aging, I feel, than that first one, which was more for oily skin breakouts. This one here is going to be a relatively easy one to do at home for anti-aging. So getting skin ready, enzymatic peel, exfoliation accelerator. And if you wanted to add in the vitamin C, 10%, you certainly could. Geri, where would you add that in?
The vitamin C?
Yes.
Probably first.
Okay, before the even enzymatic peel.
Right.
Okay, so rub in the vitamin C first. the enzymatic peel, and then the exfoliation accelerator. Okay, perfect. And this
Right.
one could also be done probably, you know, once a week. There's no reason. Sometimes peels, I mean, skincare is ongoing. You know, a lot of things that we recommend are just daily parts of your routine, but something like this that goes a little bit beyond just daily skincare can be done more than once. This one as well, I believe you can do once a week. Oh.
Okay, that's me.
Yeah.
Okay, guys, so this is the Advanced Anti-Aging at-Home Peel, and it is a peel. You will definitely peel. You will have all the anticipated reactions that you normally have when using an aggressive regimen of retinol. So this includes the Radical Night Repair. That's a 1% medical grade retinol. Some of you may already be using it. The difference here is you're going to use more of it more often. So the ideal candidate for that is going to be any kind of corrective anti-aging concerns, someone with fine lines and wrinkles, dull skin tone, surface discoloration, dry skin, large pores, oil, anything really corrective or just a great anti-aging. So the benefits, it's going to repair and strengthen your skin. It's going to stimulate your cellular turnover. It's going to even skin discoloration and hyperpigmentation. It's going to smooth your texture, reduce fine lines and wrinkles, and firm skin, going to help build collagen. So this one is a kicker. Be prepared for this. This is we're going to show you some pictures later. Brianna did it, and wow, the results are phenomenal. So this is definitely a downtime. So you're going to need this time at home. You're going to experience peeling, flaking, irritation. I dare to use the word burning, but you will experience that, but it is so worth it. So preferably what we would prefer was that you were already using some kind of retinol product. If you're not, we can retinol or a Retin-A product. If you're not, we can kind of tweak it. So there's two different protocols on this. One is for a mild protocol, and one is moderate or a little bit more aggressive. So I would suggest anyone with sensitive skin, if you are not on any kind of retinol product right now, to start with the mild. If you have dry skin, the mild. If you've been using retinol, have resilient thick skin, oilier skin, go right to the moderate. So the protocol, you're going to cleanse with part of your Get Skin Ready. You're going to use a gentle cleanser, and then you're going to use Daily Power Defense. Daily Power Defense, a lot have probably already using that as well. It is a powerhouse product filled with antioxidants. You're going to, and a little whisper of retinol in that as well. You're going to use a couple pumps of that, apply, and then wait a few minutes and kind of let that absorb, because there's a lot of the Radical Night Repair to go on. So after that absorbs a little bit, you're going to do 5 pumps of the Radical Night Repair on the mild treatment. And you're going to do 5 pumps. Wait, sorry, I got that wrong, guys. 5 pumps on the mild and 8 pumps on the moderate. So you see a little video just kind of showing the process. There's really just the 3 things: the cleanse, the Daily Power Defense, and then the Radical Night Repair. You're going to do this morning and night. So both morning and night. You only need those 3 products for this little portion of it. Okay, this particular peel. So first of all, let's talk about the precautions. This 1% medical grade retinol is strong. So our neck area is a little bit more reactive to the more aggressive treatments. So I always say just tread lightly on your neck and décolleté. So what I do is just kind of feather down after I've done my face. You're going to avoid the eye area. So as with retinol, you always stay with it or outside of this orbital bone. So you're just going to avoid in there, and you're going to avoid any permanent makeup areas because it will lighten it. No other products. So everything you need is in the Zeo Skin Health line. You don't need anything else. Your skin is going to be opening and exfoliated, and it's going to absorb everything so much quicker. You do not want to be putting any other products on. Like I said, everything you need is in that Zeo. It's filled with antioxidants, hydrating, calming and soothing ingredients, so you don't need anything else. Then you are going to have a lot of flaking, a lot of peeling. You do not want to pick at anything. And then, of course, if you are going out during the day, you must apply your sunscreen. If you're going to be, I don't suggest being in direct sun at all. If you're going to be, if it's a really sunny day, make sure you wear a hat, make sure you reapply. You just want to keep that skin protected. And then let's talk about contraindications. So if you are pregnant, trying to get pregnant, or nursing, this is not for you. Also, if you're on Accutane or have been on in the last year, or using any other kind of prescribed acne product from your physician or dermatologist, you just want to clear that with them first before you proceed with this. And then also no active acne or no active cold sores. Next.
Okay.
Geri, I have a question.
Uh-huh.
I have a question. So if for this peel, which is pretty strong and they are going to have the side effects and reactions, if they have a history of cold sores, do they need to be pre-treated ahead of time like I do for, or like we do for lasers or microneedling?
It is not in the protocol that they would need to be treated.
Okay.
Again, that would be something maybe they would ask their doctor, or not that I have heard. I can check with our Zeo rep too and get more information on that if anybody has a question regarding that.
Okay, thank you.
Good question.
Yeah, good question.
Okay, guys, so I'm going to share a little bit with you about my journey. I am 10 days from doing this at-home radical night repair peel, and I really, really loved it. When I was in the throes of it, I didn't love it, but getting through it, you've just got to push through and get through it. So the pictures that you're seeing here are my day 1 and my day 8. And the reason why I chose to do this peel is I felt that my texture was dull, my skin tone was uneven. You can see that my pores are enlarged, and I have a lot of photo damage, and I just wanted to kind of clean everything off as best as I can so I can use my rest of my Zeo regimen, and the products will really penetrate a lot better. So I'm going to show you the pictures of my days, and I don't have every day in here, and I'll tell you why. Day 1 through day 3, it was pretty tolerable for me. I am someone that is a chronic Zeo user. I do use great products on my skin. I've done a lot of great treatments and services at the spa just to help strengthen and keep it as best as I can. So day 1 through day 3, I was pretty okay. And then by day 4, day 5, you'll see right here, I really started to get irritated skin, and it just started kind of going up my face. Day 5 is here, and this is, you'll see kind of like almost like a glaze that happened on my skin, and it was getting very hard, like it was ready to just exfoliate. So by day 5, I was irritated, I was red, blotchy, lots of peeling. The peeling happened a lot around my mouth first, and I think it's probably because I talked too much, and then it just kind of went up my face. Day 6, you'll see here, and that was the first day after I finished my protocol. So I should step back. I did the mild protocol, so I did the 5 pumps of radical night repair morning and night. So this is day 6, and the great thing about having Nadine and Geri is I would phone a friend all the time and call and text them like, I'm peeling everywhere. Can I just use a little tiny exfoliating polish to help get some of this dry skin off? And they were really great because I did text them every day and send pictures. And then day 7, day 8, you can tell, you'll be able to see another close-up coming up. My tone's better, my texture's better. My fine lines and wrinkles actually got better. I wasn't anticipating that to be something that would help me with this, but it did. And the photo damage, it's incredible. So this here that you're seeing now, this is day 5 over here. So that's when I was talking about that glaze. So you can see kind of like that glaze there. You can see all of my pigmentation. I have a lot of photo damage. And then on day 6, this is where, and it actually doesn't look too bad there, but I had a lot of flaking. I was very red and pretty irritated. Starting on day 6, once the protocol was over, you can use the gentle cleanser, and then you can also use the hydrating cream. The hydrating cream is great, and it really becomes like your best friend for the next couple days because it helps to soothe and calm the skin down. And then you'll see here, this is day 8, and I did still have a little bit of flaking and peeling left to go. But if you look at the progression, it's, for me, I'm so happy with it. I was looking in the mirror, like Nadine said earlier, you look at yourself so much, you're just sitting at home, and I just wanted to do something to help kind of improve these issues, and I'm really happy that I did. Dr. Obagi said that without reaction, there is no repair, and without repair, there is no result. So that's so true. Like, you really have to, you've got to stick with it, you've got to push through it, and the results are there. And now my products, I think, will just work so much better.
Definitely will. There's a couple questions here. Can I jump in there?
Yeah.
So someone asked a question, what kind of peeling and downtime can you expect with each of these peels? So you covered pretty much on the Radical Night Repair, which is going to be intense peeling, flaking, dry skin. Nadine, with the other two, should they expect peeling, flaking, anything like that?
Right. For the first one that I went over, which was more for the oily skin, acne prone skin, that one, no, I don't really see any side effects from at all. That is the complexion renewal. No, those two things, even though they might exfoliate a little, it's something that's happening that you can't physically see. But the second one, the skin brightening one, yes, sometimes you can see a little flaking. When I've done it, and the times, which I don't always see flaking, but the times that I have seen flaking, I've seen the flaking up here and around my mouth, but it was flaking. I would not call it peeling. And after exfoliating, maybe the next day, it was gone. So it's nothing like we're giving an example for this one, the Radical Night Repair. For the other two, much less side effects.
Okay, I also have an answer for you on the cold sores. So okay, in their book, it does suggest that patients with a history of cold sores, it is recommended to go on their antiviral prescription.
Okay, all so right, for this peel then, if anybody is,
right,
if anyone is interested in this peel, if you're a patient already in our practice, I can send you out a prescription for that, and I would tell you how to use it. And if you're a patient who's not in our practice yet, but would like to do this peel and has a history of cold sores, you'll become a patient in our practice, and I'll still be able to send that out for you to use a couple days before and a couple days after your peel then.
Okay, one more question in regards to the Radical Night Repair peel. You can do that every other month during like a corrective phase. If you're really doing some some needed correction, you can do that like every other month. So until you have the results that you want.
Perfect. Is there any more questions?
That's it on questions.
Okay.
Hey, there's also one, Brianna. What's the name of the video? Someone wanted to know the full video of Geri. Like, does it have a title to it?
It is called the ZO Skin Health Anti-Aging Radical Night Repair Peel. So if you go onto our YouTube channel, that's Estique Medical, you'll be able to find that. And also on there as well, I posted a video of myself on day 6. So you when you see it, you'll see I was very red. I was flaking. I was putting my face all up in the camera just to get a little personal, and went through my journey. So you'll be able to see that as well on our YouTube channel. But this was the mild peel. I loved it. I thought it was great. I'm definitely going to do it again. I might even try and bump it up, probably after summer, just to get rid of all the photo damage that I'm sure I will be getting. But yeah. So I'm going to kick this back to Geri. Excellent treatment. Again, Radical Night Repair is such a good treatment, and it's a great start, but it's not the end all be all. You do have to do a little stuff at home to keep up.
Before
I do.
Oops, sorry.
I was going to say, there's one more question.
Sure.
Yeah, that's what I was just going to.
Were you? Okay, yeah, Geri, there's one that says, is there a big difference in the results of this anti-aging kit? So I guess the Radical Night Repair versus using Retin-A alone.
The difference here is you're going to be using the retinol, the 1% medical grade retinol, both in the morning and in the evening, and you're going to be using much more. Normally you use a pea-size amount of Retin-A. This you're using either 5 or 8 pumps. And Brianna can talk about it. It takes a while to get it in. I mean, it doesn't absorb in like how Retin-A does. You really have to work, and it takes a while. So the anticipated reactions come quick and hard, fast and furious. So I do believe there is a big difference than if you're using, Retin-A a few times a week.
And it's so worth it. I mean, to be honest, I'm not on Retin-A, but again, I do have pretty thick skin because I've been using the ZO line for quite a long time. If you're not on a retinol, you definitely should have a virtual consultation with Nadine or Geri to go over what your skin's like, just so you can, even if you have to kind of change up the protocol a little bit for your skin to make sure that it's okay. But it's not, it is lots of flaking, lots of peeling, lots of redness, pretty irritated skin, but you just push through it. It's so worth it. It's so worth it.
Perfect.
Okay, so home care. I can't express how important it is to continue getting results with your home care regimen. For example, this picture here is someone who's just doing Get Skin Ready and then adding Radical Night Repair. So that just right there is such a big difference in how her skin looks. More radiant, less hyperpigmentation, actually looks a little firmer. So I always think, like, you wouldn't decide, you know what, I need to get healthy and build some muscles. You wouldn't go to the gym for a month and then say, okay, I'm done. So if you get on one of these good peels to start off, you really want to extend that and get on a great regimen. Get on a, and be consistent. It's so important to continue stimulating your cellular activity, turning over those cells, keeping hyperpigmentation at bay, keeping those, any fine lines from forming. So home care is so important. And the next screen is going to tell you the standard rule is 80% of the results you get are what you do at home. So it's just so important. You can have amazing, wonderful, radiant skin. You just have to do your part at home. And of course, Dr. Obaji's, one of his quotes is, if you want to feel good, have a martini. Real skin health takes work. And it does. You have to make it a priority. So.
Just a question, Geri, like for someone like me who just finished this Radical Night Repair peel, how would I keep that Radical Night Repair in my regimen? What would you say that I could use that for, maybe a retinol ongoing?
So you could continue to use that retinol after you get your skin healed and calmed, and then you can add it back in, whether you want to do it every third night, every other night. Eventually, if you can get to where you're using it every night, it is great. Your skin just has to adapt to it. So you have to start out slowly. You know, you've done that good corrective work and you want to keep those results going. So you definitely want to keep that in your regimen.
Perfect. I'm going to take notes so I remember that.
Okay, so this is Rachel. She's an actual client with Esthetic. This is just can show you the results that you can get with Zeo Skin Care. It just blows me away. So this is just 8 weeks of Get Skin Ready and then Bright Alive. So one, you know, your basic cleanse, tone, exfoliate, and one powerhouse product. So the results to me are phenomenal. Her skin is radiant. Her hyperpigmentation is reduced. It's just bright. It's clear. You are just not going to get that with an over-the-counter skincare line. It's not going to happen. So her texture is smoother. Just, it's amazing when you stick with that regimen, what your results are like.
And can you talk a little bit about Bright Alive? Like what kind of product is that?
Bright Alive, it's a brightening product. I have the workbook right here because I don't have all these memorized, but let me pull it up here. Give you more information on it.
So Bright Alive is one of those products that's a non-retinol product. So
it's a non-retinol.
Exactly.
And that's also one of the safe ones to use during pregnancy and breastfeeding. If somebody's, because a lot of these prescription ones like Retin A and hydroquinone for pigmentation, it's not recommended to use during pregnancy, but Bright Alive is one that can.
Right. So the Bright Alive is a gentle non-hydroquinone, non-retinol brightener for mildly pigmented skin. So, I mean, I would almost look at her skin and think it's more moderate, but it's just amazing what it's done there. Mm-hmm. So then we also have a retinol skin brightener that actually has some retinol in it as well as some brightening ingredients.
So someone like Rachel went on this Get Skin Ready line with the Bright Alive, and she really did a good job at prepping her skin. So now she can come in and get even better results on some other different things that we do in our spa.
Right. So our at the spa services, we'll talk about those just to continue the correction and keeping your skin anti-aging, you know, staying on top of that. So first we'll talk about the hydrofacial. Hydrofacial, if you have not had one yet, you must get one as soon as we open. So it is really the most powerful non-invasive facial there is out there. If you Google it, there's so much information, so many people talking about it. It is a red carpet facial. It physically and chemically exfoliates. It extracts, and this is all being done at the same simultaneously. Does extractions and then infuses just this wonderful cocktail of antioxidants, peptides, hydrators. Your skin is just glowing. It is plumped. It is a definite bride. Any bride should have this anytime you have an event, because your skin is just glowing and radiant. And it can be done monthly as well. It's a very, very results-driven facial. Next is dermaplaning. So dermaplaning, or right underneath, that is a physical exfoliation that also is going to remove vellus, or what we call peach fuzz hair on the face. So first thing is, it does not grow back thick. That is one of the main questions we always get. It grows back your hair grows back just how it was, peach fuzzy. Any type of exfoliation, you're really getting dead skin cells off. You're going to have better product penetration. You know, one thing I always say is, if you do not exfoliate, you're just putting these amazing products on top of dead skin. And then you just wash away because it can't absorb, because you've got all this dead skin sitting on top. So the dermaplaning is a wonderful exfoliation, great for brightening the skin, fading hyperpigmentation, helping to smooth fine lines and wrinkles. And then microneedling
Oh,
is.
can I ask a question?
Sure.
Sure. Isn't that our pretty little nurse practitioner from Shady Side right there
Is that
in
Maria?
that picture?
That's
That is
Aw.
Maria being our model for dermaplaning.
That's awesome.
And Maria's also the one who takes care of my Botox and filler needs.
Mine too.
And I need to see you, Maria.
So microneedling is collagen induction therapy. So it was FDA approved actually for acne scarring, and is just amazing for not only acne scarring, but anti-aging, collagen building, same thing, smoothing fine lines. So what microneedling, and it's really controlled trauma to the skin. And when there's the pins that are needles that penetrate the skin. And when that happens, it triggers our immune system. Our immune system kicks in and starts throwing out growth factors and what are called cytokines. And that helps rebuild and remodel the skin. So that amazing, amazing treatment there as well. You can also have it done with PRP, which is platelets-rich plasma. And your blood is drawn, it's spun, and the PRP is then worked in through the treatment that really helps even boost that growth factor more, and helps so much more with healing and bringing that down. So, and then Nadine's going to tell you about the rest.
Couple others. Yeah, the one right below microneedling is something called BBL, Forever Young Photofacial. BBL stands for broadband light. It's a form, like an advanced form of IPL, which has been around for a long time. It is mostly, to put it simply, it's mostly used for reds and browns. By that I mean pigmentation. Like on that example, you can see pretty significant pigmentation on the side of her face and up on her cheeks. And as far as reds stuff, I usually mean like around the nose, small vessels that we get, and even across the cheeks. That is a type of laser-like device that can be 1 to 3 treatments. Those patients respond so much better to the laser when they've prepped their skin effectively with the GSR and products before the photofacial. It's not an absolute requirement, but those people who are taking care of their skin with ZO, I see much better results for them. Next one up top is one of my absolute favorite procedures that I do, and that Maria also does, is Botox. Botox has been around for a long time now. In fact, it has a birthday coming up. And next week, a week from today, we're going to have a birthday party for Botox at our 1 p.m. webinar next week. So please join me for that. Botox is pretty much for the upper face. They are injections that treat a muscle to smooth a line. We have 2 examples here of the crow's feet and the horizontal lines of the forehead. Below that is dermal filler. Dermal fillers as well have been around quite a long time. Originally was collagen, and now we've moved on for about 20 years now to hyaluronic acid fillers. These are used usually in the lower face, and these are some examples of patients before and after for lip filler, and the other one is just someone getting their lips, getting their lips injected.
These are really all the great things that you're going to get a good result, but if you have that GSR or you do these at-home facials or the peel just to really prep your skin, your result's going to be a lot better. And when we talk to our patients and ask them, you know, what do you love about Estique? Why do you love coming to us? And this is what they say. They love that we have professional products. They love that it's a medical grade skincare line. You can't buy this, like Nadine and Geri were saying earlier, you can't buy this anywhere. You need to go to a physician's office that dispenses it. You'll also be able to get personal coaches. If you buy a product in the mall, you have some kind of question or thing going on, what are you going to do? Now you'll have coaches, Nadine and Geri, for these that'll be able to hold your hand and walk you through every step of the way through either of the facials or the peel, or even the skincare if there's questions on that. And they follow up.
And we would be okay if you did what Brianna did. If you send us pictures and say, look how I'm feeling, or look how red I am, what should I do? That's what we're here for. If you want on any of these peels, and particularly the third one, the Radical Night Repair, we're your coaches for this. We're here at home too. You can email us, call us, Zoom us, and we can coach you through these.
And they also follow up. So it's not that you're just hanging out there. They want to check in and see how you're doing and see what they can do to help. And sometimes we're even doing right now seasonal skincare assessments where people are already on a lot of the ZO products, but it's springtime. So you need to kind of change up what you're doing, but how do you know what to do? So you schedule a virtual consult, and these lovely ladies can help tell you this will work, this won't work, and they follow up. So having said all of that, this is to choose the ideal peel for you or at-home facial. This is kind of how we have it laid out. The first one that Nadine talked about was the complexion restoration at-home facial. And just one more time again, Nadine, who would this be, like teenagers, people with hormonal
Yes,
skin changes?
right. Oily skin, teenagers. And it is perfectly fine to do on teenagers, because I do this exact one on my son. People with hormonal acne or just excess oiliness as well. They really want to kind of calm their skin down a little.
Perfect. So what you see pictured there is exactly what you would get with this kit. It would come with the Get Skin Ready, which is the cleanser, toner, and exfoliator. You would also get the enzymatic peel and the sulfur mask. And just because I think this would probably be asked as a question, you can use these products. It's not you do this facial and it's one and done. You'll be able to still incorporate these products in your regimen and use them, especially the GSR, and all of these you can use all the time. The skin brightening at-home facial, again, if you feel dull and you want to brighten up, this is probably the ideal one for you. And you'll see on here, if you decide, everybody that joined the webinar does get that $25 gift card that you can use towards your products or treatments. If you decide you want to apply it to this, you definitely can. You don't have to. You can use that for something else in our spa, but you'll see on here the totals if you decide to apply it or not apply it. And the anti-aging at-home peel. So typically that's $380. You do get all of those great products. And if you apply the $25, it's $355. And we're also giving anyone who purchases this the travel size hydrating cream. So you can have that in your ZO collection. Do you ladies want to add anything else to these facials or peels on anything that might be a question?
Only about the calming or the hydrating cream. That is a lifesaver. I remember even when I had microneedling and I was feeling prickly and I was like, I just wanted to calm down. That hydrating cream was amazing. So they'll take advantage of that, as they're healing from the Radical Night Repair, but it certainly can be used for other things as well, such as if in the office they come in for microneedling.
Definitely, Nadine. That hydrating cream, can you hear me?
Yep.
Oh, that hydrating cream is your best friend after that, the 3 or 5 days of that. And like you said, it can be used, you can use that. Anyone in the family can use that. It has calming ingredients. So if you had, irritated anywhere in your body, you don't just have to use it on your face. So that is a amazing product, that hydrating cream.
Right.
Just to add on that too, my 4-year-old son has eczema pretty badly, and this is the only thing that helps him. There's no fragrance in it. It's really natural, and thankfully we have a lot of tubes of that because we go through it quite often. So these are the 3 kits: the complexion restoration at-home facial, the skin brightening at-home facial, and the anti-aging at-home peel. And you'll see on the bottom there is a link that you can directly go to it. We tried to make this name a little different, but we didn't get to. So it's Boom Time, which is, I think, hysterical. So Estique.com, Estique.boomtime.com. Gift. So if you click on that, that'll take you right to a page where you can purchase any one of these kits. And you can either apply that $25 gift card, or you don't have to. You can pay cost for it. and save that $25 gift card for when you can come back into our spa. And just to show you too, this is what you'll be receiving. These are the kits up here. So this one's the complexion restoration. The products are in it. You'll be getting the Get Skin Ready is in here. There's a full protocol, and Geri and Nadine's card will be in here. So this is kind of what it'll look like that you get. And we keep preaching GSR, GSR, GSR. This is
GSR.
This is definitely the fundamental of the line. And anybody who's not on a skincare now, or maybe you're using, you know, like Clinique or Neutrogena or soap and water, we hear a lot from people. This is great. Like, this is going to help you. You are going to see a difference. You will see results from this. There's two different kinds of kits. One's for a more all skin type, and then there's a normal to oily. So that can also be purchased on that link as well. And again, anybody that attended the webinar, you will get a $25 gift card. We will be sending out a thank you, and your gift card will be in there. So if you decide to buy products, we can apply it to that if you choose. If not, that's okay. You'll get complimentary shipping, and you'll get Geri and Nadine that are going to hold your hand and walk the journey with you. So let's make another date. If you decide you want to purchase any of the peels or facials, then what we'll do is once that's set up, we will contact you, and we'll get a 2-week virtual checkup that you can do with either Geri or Nadine to kind of talk about how everything's going, any kind of questions. You don't have to wait the 2 weeks. I mean, obviously they're there for you. So if you're like me, you send lots of pictures and it's 10 o'clock at night, what can I do? They're there for you. And also, certainly, if you have any other skincare questions or even treatment or procedure questions like what you saw, just email us. We can set up a virtual consultation. You can go over everything. You can see precautions, contraindications, before and afters, all that great stuff. Did you want to say something, Nadine?
No.
Okay.
You're good.
And again, that link on the bottom is estique.boomtime.com/lgift. And just to touch on, I'll let Nadine touch on this. This is our webinar next Thursday.
Yeah, a week from today. And we're going to try, as long as we're quarantined, we're going to try to have a once a week webinar, Thursdays at 1 o'clock. The next one we're doing after today is on Botox. It is Botox's birthday. Botox was FDA approved on April 15th, 2002. So Botox has been revolutionary for women and men, but mostly for women, changing their upper face. I think it's something that most of us can't do without. And if my Instagram is any indication of whether women, my patients, miss their Botox or not, they do. So if you're interested in seeing what all Botox has been about or what it is about, join me next week for a presentation on Botox, and wishing it a happy birthday.
And also, we have our plastic surgeons who are kind of kicking off their own sort of series. So they're going to, on Tuesdays, start talking about Estique plastic surgeons' secrets to looking your personal best. And Dr. Lazaro and Dr. Camp will be live on Tuesday, April 21st at 1 o'clock. So if you're interested, the link is here. It's estique.com/complimentary-webinars/ and you can sign up there to be live on their webinar, talking about all kinds of different questions that people have about breast augmentation. So whether you're someone that's thinking about it and want to know kind of what questions you should be asking, or someone that has had it done and they might have some questions on, do I need to get them removed and replaced or anything like that, this is a great platform to do it. So please sign up. We will, again, be sending out that thank you, and all of this information will be in there. So don't feel like you need to remember it. You can click on the link. You'll be able to go to it. Do we have any other questions before we completely wrap up? Do we see any up there?
Here's a question, Brianna. Can I use a gift card for a facial once you reopen?
Sure. And you can use that $25 too if you want to apply it towards that as well. I guess you can. And we're really
Yeah.
hoping to be open soon. We're all so eager, but we're glad that we can still connect with you on a different kind of platform, but still be able to be sort of close to you. So that's our presentation. I have Nadine and Geri's information here. You want to make sure that if you don't follow us on Facebook and Instagram. We also have a YouTube channel, and you'll want to, we have really great posts that are coming up and lots of live videos and things like that. So ladies, do you have anything else?
I don't think so.
Just stay safe and stay well. Can't wait to see y'all.
Exactly.
All right, guys. Thank you for joining us.
Thank you all for joining us.
Thank you.
Bye-bye.